Today, we're going to be discussing blood sugar and what changes with that as we age, because it does change as we age. There's a lot of things that we're navigating in menopause, perimenopause, and midlife, but blood sugar is one of those key things that we've got to grasp, get under control. It causes a whole host of problems when we don't. So today on Midlife Conversations, I've got my good friend, Dr. Mariza Snyder, and she's an expert with a lot of things that we're going to get into today. But one of the things that really got my attention, the reason I wanted to bring her on and interview her, I've had her on before, is this whole conversation around blood sugar, why it changes in midlife, like what's going on there, how this correlates to hormones, and what we can actually do to control this. Because the answer is not always just you need metformin or you're going to be a type 2 diabetic, deal with it. So thank you so much for being here, Dr. Mariza.
Hey, honey, how are you? It's so good to see you, and thank you for having me.
Yeah, I can't wait to dive in. And by the way, those of you listening in right now, if you're listening on the podcast, make sure that you're subscribed to the podcast so you don't miss a future episode. And if you're watching this on YouTube, that's great. We've recently started adding all of these to YouTube and really up-leveling those so you can see a lot of the things that we're talking about. If you're there, make sure you hit subscribe if you're on YouTube so you don't miss an episode. Okay, Dr. Mariza, let's sort of dive in. How did blood sugar become this interesting topic to you?
It became a very interesting topic to me because I, like yourself, get to serve women in their 40s and 50s and beyond. And a lot of women were coming to me with weight resistance and the struggle around really symptoms of insulin resistance and crazy blood glucose variability. Things like poor sleep, getting sick often, again, that tummy, belly fat, hot flashes, and night sweats. A lot of women don't realize that there is a deep connection between vasomotor symptoms and blood sugar issues and insulin resistance. And then also even acne, fatigue, fibroids, reproductive issues like polycystic ovarian syndrome. And so I started connecting the dots and I was like, okay, what is really the root cause? And so often we're all told it's hormones. And yes, insulin is a hormone. So it very much is a part of that conversation. But I realized that many of the women I was working with were being told their labs look normal, everything looked normal, even when they were pre-diabetic. And yet they had these, what I call subtle symptoms or kind of these other chronic conditions that were going on that weren't being associated to metabolic health. And I started putting the pieces together. I'm like, oh my gosh, this is very much a metabolic situation that we got to wrap our mind around.
Okay, so I want to dive into this because metabolic syndrome is truly the root of so many diseases. So I want to back up a little bit. And I know this might sound basic to some, but I think it's important we revisit this. Let's talk first about metabolic syndrome. What is that and what is that linked to?
Yeah, so how we diagnose metabolic syndrome is there are 4 metabolic biomarkers, indicators. Number 1, it's going to be your fasting blood glucose. So I have a continuous glucose monitor on right now. And when you go to your doctor, they're going to run this panel every single time. So fasting blood glucose, they're going to say they want it under 100 milligrams per deciliter. I don't want it above 90. I mean, when I start to see it creeping in the 90s, I'm like, let's get that under control. So that's one. And when
so you're fasting, meaning when you first wake up in the morning before you've had anything to eat. So not like in between meals, just when you wake up in the morning.
Exactly. So when you go and run your physical, hopefully you're doing an annual physical or at least getting the labs ran. I always tell women, like, get a timeline of your labs so we have a sense of what's going on with your body, especially as you start to go into perimenopause and declining reproductive hormones start to have an impact on these labs. Like all of a sudden women wake up and their cholesterol is just out of control, like out of unfavorable range. And they're like, what happened? Those are reproductive hormones shifting. But so fasting blood glucose, triglycerides. So again, they want a normal triglyceride is anything lower than 150 milligrams per deciliter. I don't want it above 80.
Okay.
So just a heads up. But again, doctor is going to be like, oh, it's fine. It's good.
Because you're talking optimal versus just standard testing.
Yeah, standard testing. So, and note that once it's at 150 milligrams per deciliter, I mean, that's a massive indicator of insulin resistance as well. Yeah. Then we're looking at HDLs. And HDL is that good cholesterol. We want to have it high. And really for women, it's over the number of 40 milligrams per deciliter. Optimally, I would love it above 50. Okay. So you want to be looking at that. And then it is going to be blood pressure. So those were the first 3. Blood pressure is next. Normal blood pressure is 120/70. But what they consider unfavorable or a diagnosis of metabolic syndrome is 130/80. And the last is going to be the inches around your waist. So women, if your waistline is greater than 35 inches and men greater than 40 inches, that if you have 3 of these markers out of range, you would be diagnosed with metabolic syndrome.
Okay. So 3 of these markers out of range means metabolic. So if you just have high cholesterol or you just have one of them, that's not necessarily metabolic syndrome. If you have metabolic syndrome, what does that actually mean? What does that create?
That means that what I think it means in mitochondrial scientists, because ultimately all of this is cellular energy, right? Your cells are gunked up, there's inflammation in the body. But I believe that once your mitochondrial capacity drops below 50%, so basically these little powerhouses in the cell that make all the energy for you and I to have this conversation, for anybody to be watching us have this conversation, any feeling, any thought, any physical movement requires ATP, requires cellular energy that's manufactured from our mitochondria. When our mitochondria get below that 50% capacity, that's when we start to see these biomarkers go out of range. And so to me, what it tells me is that our cellular energy is significantly compromised.
And if our cellular energy is significantly compromised, what does that create?
So that could create dementia. That could create cardiovascular disease. That could create polycystic ovarian syndrome. Wow. That could create, I mean, I can go through every single system of the body, Natalie, and name a disease state due to, higher levels of blood glucose or metabolic syndrome, that one being the biggest facet of it. And basically an issue with cellular metabolism inside of the cells of our body.
Okay. So I have so many questions now from here because I'm going to want to ask, what do we do about it? But I want to rewind a little bit. And how do we look at these things individually? And should we be looking at them individually? Like, do we need to be looking at cholesterol separate? Then we look at blood sugar. Or are you looking at all of this as a whole? Help us understand this.
Absolutely. I mean, a great doctor, an integrative doctor is really looking at all of this as a whole. But if we were to take a look at if I had to name a biomarker, I was like, if I had to look at the biomarker besides like an inflammatory biomarker, like highly sensitive C-reactive protein, because I'd like to know is the body inflamed? The biomarker that I would love that is unfortunately not readily available. You can ask for it and they're probably not going to do it, but it's extremely cheap and there's no reason why they should not run it. It's going to be your fasting insulin. So before your A1C, your hemoglobin A1C goes up, or well before your fasting blood glucose is closer to 100, which is pre-diabetes, we know that for a decade, your insulin levels are less sensitive, meaning that they've become more resistant.
Wow.
And the test that can tell you that, like 10 years in advance and note that insulin resistance is kind of the reason for higher levels of triglycerides. If our cells cannot intake more of that sugar, it converts to fat. It converts to triglycerides. So anytime I see a high triglyceride number, I know for a fact that we're dealing with insulin resistance. And so if I see high blood pressure, I know for a fact that we are dealing with insulin resistance. And so all of those biomarkers are really indicating this more insidious issue, which is insulin resistance. So
and this is important because I think a lot of doctors are overlooking this and they're just saying, no, your A1C is normal. Your A1C is your combination of your blood sugar over 3 months. And they're saying your fasting is 100 or, right at that mark there. So it's not at that 90. And they're saying, so they're not even looking at this part with insulin and seeing that trend.
No, and this is very disalarming as far as I'm concerned, because insulin could be resistant, like it could be pouring out of your pancreas, trying to shove that glucose into the cells, kind of like a train pusher in Japan. Have you ever seen those? They're just trying to shove people onto the train. All the while, your blood glucose can look pretty normal. And behind the scenes, there is a war raging of basically a dysfunctional situation of cellular energy. Basically, we're not converting energy efficiently. And it takes years before it actually shows up on a blood test, like a hemoglobin A1C or on a fasting blood glucose.
So what's extra concerning about this to me is that, okay, so you mentioned triglycerides, not necessarily cholesterol, even though they somewhat go together. So someone could have a high triglyceride or a higher cholesterol or one or the other. And then what the doctor might say is, okay, let's give you a statin. Let's put you on cholesterol medicine, which is now just giving kind of a Band-Aid of what was creating that, in my view. So we start knocking down these numbers without actually addressing the root cause. Am I accurate? Am I thinking there?
Absolutely. Well, and research is very clear when it comes to statins is that they do not increase mortality rate. They do not especially in women, they do not reduce.
You mean they don't decrease? You said that.
Sorry. They don't decrease. It ends up with
like 2%, something like that, right?
It's even less than that. And then the side effects of taking things like that, like statins can lend towards more insulin resistance, which is the number one risk factor and root cause for ischemic attack or stroke.
Okay, I have some random questions. I don't know if they're connected or not, but I want to make sure I'm covering these. So, okay, if your triglycerides are actually normal, but your cholesterol is high, your LDL is high, is that still a marker?
Yes, that is still a marker for cardiometabolic disease. Yes.
Okay. So let's talk about blood sugar then, because you think that this is a lot of the root cause for things, or do you think something's creating the blood sugar issue? What is
Oh yeah, no, there's definitely things that are causing this. Why is the cell malfunctioning?
Right.
And I would say there's a number of them, but the number one is overconsumption of ultra processed foods.
Okay.
I think the average person is consuming like 60% of their calories are coming from ultra processed foods. It's almost impossible to escape them today.
Yeah,
Even
I think if
your almond milk or your oat milk, guess what? It's got preservatives and gums and seed oils. I mean, you take a look at the label and you're like, organic or not, it could have, it still has organic sunflower oil.
So you're preaching to the choir with me as far as unprocessing your diet. And I tell women, unprocess your diet. That has to be the absolute first must in midlife. What about the person listening that is eating an unprocessed diet and they're still creeping up on their blood sugar?
Yeah, let's take a look at that as well. So also it's acellular carbs. So I always say that, again, we can go into why we become a little bit less insulin sensitive in general.
Yeah.
But, the breads, the gluten-free crackers, all those types of things that just are lacking fiber are ultimately going to spike your blood sugar. I mean, I wear a CGM and continuously I'm like, oh, like something I thought maybe not. And I'm like, oh, no. Like even sweet potatoes for some women can be a big
For me,
blood
they're
sugar
crazy.
spiker.
Yeah, sweet potatoes will drive mine up huge.
Yeah. And so we start to learn these things about our body and the way that our bodies work. And so if I eat a naked carb, even if it's an amazing naked carb, like even an apple without almond butter, it's most likely going to have kind of more of a spike in my blood glucose. And so it's important to note, like eating carbs naked by themselves, whether they're acellular, maybe even some fruit like grapes. Grapes are high blood sugar spikers that, you're having these snacks, maybe at 2:00 in the afternoon, that may be setting off that cascade. Or maybe you're not thinking that little bit of sugar, that little bit of honey in your coffee first thing in the morning is also setting the tone for what's going on with your blood sugar. I always tell people what you eat for breakfast is going to set the tone for your blood sugar, your basically and insulin as well, right? What comes into the system has to be modulated by insulin so that it goes into your cells. And so with that rise in blood glucose, you're going to see that rise in insulin as well. It's going to be the same, same experience. And so if you're eating an unsavory breakfast, it's more of a, carb driven breakfast. Then if you eat a very sugary breakfast or, again, just toast and jam and a little bit of sugar in your coffee,
oatmeal and banana, even
oatmeal and banana. Yeah. A little bit of maple syrup, like maple syrup is not sugar. I don't know where this comes from. Even protein pancakes, I make protein pancakes for my 3-year-old, but I'm not eating those protein pancakes. It's not going to have the same effect at 45 years old. It'll take over 36 hours to recover from that blood glucose. Spike.
Let me ask you about these blood glucose spikes, because people listening, they might be interested in CGMs or they're using a finger prick. A CGM is a continual glucose monitor like she has on her arm. Finger pricks are actually a little bit more accurate because there can be a calibration period on CGMs. But can we talk about normal ranges? Like what you, as in the functional practice, what you believe is for optimal, what numbers are alarming and where do you try to stay?
Absolutely. So when I'm putting on a CGM, I get to set basically my blood glucose range in milligrams per deciliter. It's how we measure it. And I set it, the low bar is 70 and my highest bar is 120. Okay. So, and normally on a normal CGM, it's 70 to 140 or maybe even 150. We know that a spike past 140 is basically in the diabetic range.
Wow.
And so let's start first thing in the morning. That's the first thing I do every morning when I have a CGM on is I scan my sensor. That's going to be my fasting blood glucose. Now, most CGMs, they're on the underside of your arm. They snap in really quickly, almost pretty much painlessly. It takes, like you said, about 24 hours to calibrate it, and then it's good to go for 14 days. And the first thing I do is I scan that. And what I'm looking for is I want a fasting blood glucose between 70 and no higher than 85 milligrams per deciliter. Most of the time, mine scans under 80 milligrams per deciliter. So I'm like 77, 75, 76. And then I'll watch it after that first meal of the day. What is that? Because anytime you eat, you're going to have a blood glucose response. response. That is totally normal. Don't expect that it's going to stay static the whole day. And I usually test I'll check it again 1 hour and 2 hours. I'm curious what's going to happen. And it's extremely rare. Optimal, I would say, is you're staying in the range of 90 to 120 milligrams per deciliter. I personally, because I've been doing this for a long time and I really dial in my metabolic health, I rarely go past 110. So post meal, what I call 2 hours postprandial blood glucose is around 110.
Okay.
Yeah.
So then alarming, and I don't want to, when I say alarming, I want people to hear this. We're going to share alarming numbers, but just because you have alarming numbers doesn't mean you can't control it. So I am that example, by the way. If I were to eat a sweet potato for breakfast and nothing else, my blood sugar would go probably over 200, which is alarming. That is pre-diabetic mode. But because I do not eat that way, I keep my blood sugar low, like you are sharing, Dr. Mariza. So I want everyone to feel empowered by this. It doesn't mean you're testing this and something shoots up that all of a sudden you're diabetic and you have to go on medication for it. It just means you get to work on combining your food and changing how you're eating. Is that,
yes, and there's
correct me
so
if I'm wrong,
much that you can do lifestyle wise to get this under control. And so an example of this is I was at an engagement party the other night and I have an autoimmune condition. So I'm gluten-free and dairy-free. And they had picked up this insane decadent dairy-free, gluten-free cacao cake.
Which was all sugar.
It's all sugar. Yeah, no, it was not sugar-free. Let me tell you. And I knew I usually finish dinner by 6 o'clock at the latest, because I love the sooner I eat dinner, the more I bounce back. We're more insulin resistant at night, just because that's our circadian clock. That's how our bodies work. And so I've learned that if I have salmon and salad at 6 o'clock, I'm again, maybe 109, 110 milligrams per deciliter a couple hours after that meal. But if I were to eat that same exact meal, again, salmon and salad, there's no carbs here. Vegetables are carbs, but nothing that's going to quote unquote rise my blood sugar. Just the 2 hour difference later in the night, I will jump up to 120 milligrams per deciliter, same exact meal. So it's 7. And I have made a decision. I'm going to have this cake. And mind you, it's an engagement party. So
you're also human. You're trying to live your life.
Human. Yeah. I mean, it's this gorgeous boutique. I mean, it's 40 minutes away to even get this cake. Like, I'm not driving there in downtown San Diego, and I eat it, and I'm in a really cute dress. So I'm not doing air squats. I'm not doing jump lunges or jack squats after this. Like, I'm talking to people, I'm hanging out. And so I checked my blood sugar. It goes up to 135. The next morning, my fasting blood glucose was 88. And this was Saturday night. So today I'm finally recovering from that cake.
Wow. Takes that
and
long.
Here's the thing. I knew that. And did I implement all of my other blood sugar strategies and eat really beautifully and eat metabolically healthy these last couple of days? Absolutely. But at 45, it takes a little minute to rebound. So I always want people to know, if you decide to have that pancake for breakfast, or the sweet potato, or you have the sexy, yummy muffin with a vanilla latte, it's going to take about 36 hours for your body to rebound, even if you eat super clean for the rest of the next 36 hours.
So here's the conversation I want to open up to, because I know somebody's listening going, gosh, why does it have to, then I don't like my food, or I don't enjoy anything. But here is the thing. This is not just about weight loss, and this is about our health and
about your heart.
Yes. And every single disease is linked to this. This is
about dementia. Yeah.
So when we are eating, not combining foods, when we're not eating protein, fats, higher fiber, low glycemic foods, then we're creating this whole problem here.
Cascade.
Yes. We're creating
silently. It's happening multiple times a day, potentially.
I want to talk about a few things besides preventative, because obviously that's important, how we're eating, and we're doing that. There's a lot of things that people are doing that are somewhat trendy to manipulate and the sugar and insulin response. And I want to just kind of run down the list, and I just want to get your take on them. And I'll start kind of simple. Let's start with berberine.
Yeah. I love it. I think berberine is great. I mean, a lot of research shows that it is as effective, if not more effective, than metformin. And so I'm a big fan of, I'm really 1,000 milligrams a day, 500 before breakfast, another 500 before dinner.
So you take it before dinner, 500 of that milligrams. Okay, great. So not with food, not after food, before.
It can, ideally it's before, but I'd say up to 20 minutes after.
Great. Okay. Love berberine.
Just like apple cider vinegar. Same thing.
Okay.
Ideally 20 minutes before, but up to 20 minutes after.
Okay. let's talk about metformin now. What are your thoughts on metformin for diabetics and non-diabetics? Because that's another trendy thing in the biohacking space where people are taking metformin.
Yeah, and they're microdosing metformin. I mean,
Yes.
when it comes to biohacking, microdosing GLP-1 agonists,
Yeah, I was going to ask that next, so don't go there yet. So let's start with the metformin.
I'm a yes and. I mean, if your levels are in the pre-diabetic range and you need a kickstart to get yourself back into range, and it's not just a crutch or a band-aid, and let's say you're clocking in at a fasting blood glucose around 110. I mean, I don't think of prediabetes as prediabetes. I think of prediabetes as diabetes. Yes. I don't know why there's a pre associated. Like once you're at 100 milligrams per deciliter, we have a metabolic issue that we need to address. And so if metformin can kick you back along with consistent blood sugar hacks every single day, like you are really changing the way that you live your life, then I say yes.
So she's not saying, y'all, she's not saying metformin and go eat pasta, popcorn, oatmeal, cookies, and cake. She's saying do it to optimize how you're eating, the balanced health, low glycemic eating. Okay. So then my next question is GLP-1s. And so most people associate GLPs with tirzepatide, all the fat loss drugs. So we think it's semaglutide. We've heard of all, what's the other? I don't know.
Wegovy.
Wegovy, all those. So that is one use for it for weight loss. But then there's a whole nother camp of thought with this around doing small doses to, instead of metformin, instead of berberine, or maybe it's with it, to help this. What are your thoughts around that?
I'm a yes and. Again, especially, we're talking about smaller dosage, like even micro dosing, and
like I'm talking like 0.25, 0.50, not the standard starting dose for weight loss.
Exactly. Let's say you're in midlife. You have been an athlete, or you've worked out all your life, you've been eating at a deficit, you've hit your protein numbers, like you've done a lot of the things. And all of a sudden you put on that extra 5 to 10 pounds and there's no amount of willpower or efforting that is getting you out of there. And your metabolic labs look good. You really are still crushing it in that department. I think, bringing on and cycling, lower dose. Peptides, tirzepatide or semaglutide or Wegovy, playing with it, like cycle it maybe for 1 month off, 1 month on, and see if it can kind of, get rid of that fluff. I call it fluff. Like our metabolic labs are going to shift because of the decline of estradiol, testosterone, and progesterone. I mean, it's going to happen for the majority of us. And yes, am I a big fan of hormones as optimizers? Absolutely. And you may need a little bit of extra support there too. I mean, I think it can be a very short-term support, like a booster, to kind of get those long-term cardio metabolic benefits.
I'm starting to see just so many pluses with GLPs. And I think they got really dismissed quickly because they got looked at as
weight loss,
high dose, only weight loss. But in small doses, the research is just supporting so many benefits.
Cognitive function, reducing cognitive neuroinflammation, even inflammation of the joints. And so, I've seen a lot of great, but particularly again, if we die more of heart disease than men, and this can be a tool in the toolbox to reduce that risk, even shove it back another decade, then I mean, I'm a
huge fan. Yeah. I think I'm learning a lot more about this. I recently interviewed Dr. Tina Moore about this too. And she really enlightened me about just so many benefits with that.
Yeah. I mean, she and I are both in agreement that, those peptides, GLP-1 peptides, and some hormones, and then implementing those metabolic lifestyle strategies. I mean, why not have the trifecta to really support our bodies, especially if we see, again, a major fall off the cliff moment once we hit like 51, 52 years old.
Totally. And almost 53 over here. So I'm seeing my markers change. And then, so, a lot of people, me included, you look at the genetic markers and you say, okay, I've got a whole family history of all this. However, when you start adding these things on board, that history doesn't have to be our own reality.
No, especially my sister, she had a stroke last year. She's younger than me. She's 42. And from the Mexican side of my family, all the men in my family have had bypasses by the time they were 53 years old. And so seeing my sister have a stroke for the age of 43, I was like, oh my gosh, it just really put things in perspective of how critical it is to be looking at these numbers, even in our mid to late 30s, so that we're coming into our 40s more resilient. We all think it's in our 50s where we start to notice that lack of resilience, but no, we're seeing shifts and changes. We're losing that resilience in our 40s.
Now, I've known you for quite some time and I've never known you to be overweight. But when I saw you, gosh, I just saw you recently at an event and you are like tiny and leaner than I've ever seen you. Is this some of this because of these changes?
Yes, a big part. Well, in hormones. So I brought hormones in as well, and we can get into that.
Yeah.
But yeah, I mean, I've really, I mean, my metabolic labs are dialed. I'm really focused on hitting my protein numbers, making sure that I'm lifting heavy. I think the body composition changes with weights have been a game changer, and I move all the time.
Yeah.
I am constantly moving. I'm like what our dear friend JJ Virgin. I mean, that woman's moving exercise snacks throughout the day. I'm doing little mini hip movements. But I would say that the more consistent that I move throughout the day, the more my biomarkers just continue to optimize.
Okay, let's talk about the sex hormones now for a minute, because there is a role in that. And I'm a huge fan of adding those in midlife. And we're talking specifically estrogen, progesterone, and testosterone. Can you talk about the link with that and metabolic?
Absolutely. So even, there's not as much research to be had regarding progesterone and good metabolic health, but it's there. I mean, there's some women who are supplementing progesterone kind of as a blood sugar hack as well to lower insulin resistance in meals. So I'm really interested in that research. But again, we have more research with estradiol than we do with progesterone currently today. So perimenopause, as you know, is that I would say 5 to 10 year transition leading into that defining moment when you hit menopause and then you move over to postmenopause. And it's in that time period, that transition, kind of the descension, as one of my dear friends, Dr. Carrie Jones says, she calls it unconscious uncoupling. I call it your body is changing without permission.
Yeah. True.
I mean, no one asked, you know what I'm saying?
No.
So progesterone drops first. And what you'll notice there, especially in that second phase of your cycle, that luteal phase where she's normally abundant, you'll notice less stress resilience, less exercise resilience. You'll notice more mood changes, things like depression, anxiety, sleep disturbances, inability to get to sleep, or also waking up in the middle of the night. And then you'll also notice, I mean, even vasomotor symptoms like hot flashes and night sweats have been associated with lower levels of progesterone.
Wow.
And then comes in estradiol, and she starts to roller coaster out about I would say like early and late perimenopause. I also think there's like a mid perimenopause where you're kind of in between. But late perimenopause is defined as you are now skipping 60 days or more of your periods.
Okay.
And estradiol is very much on the decline. And we know that as we start to lose that estradiol resilience, that we begin to lose basically insulin sensitivity. So the decline of estradiol, the impact is pretty great. One, our resting metabolic rate begins to drop, not significantly, but a little bit, and it adds up. We see a redistribution in fat from our butt and our thighs to our belly.
Okay.
And that could be testosterone still may be high. So we see that kind of apple-shaped distribution relative to estradiol. But either way, all of a sudden, fat is moving in the direction you do not want it to go.
No.
You see a loss in muscle strength and a loss in muscle mass and an inability to build more muscle because we just don't have estradiol to drive that muscle protein synthesis. We see an increased rate, again, in insulin resistance, and we see a shift and change in cardiovascular flexibility and basically an increase in inflammation. So all of this is happening due to estradiol. The biggest thing I'm concerned with is, again, that body composition, that loss of muscle mass, and that creeping of insulin resistance.
Yes. Oh my gosh. Okay. So many things. So when women, it's so crazy to me because there's so much research now supporting hormones, and we've completely debunked all of those risks associated with it back from years ago with Women's Health Initiative. Like it's all been debunked.
2002. Yeah.
So to me, when a midlife woman is saying they're using it like a hero's cape, like I'm not going to do estrogen replenishment, or I'm not going to do hormone, I think you're just missing such a huge piece of the puzzle.
Yeah. And unfortunately, the dark looming cloud that the Women's Health Initiative brought to women globally it's still very much very pervasive today. Yes. I literally just got my hair cut for you. My hair, I just got it done. I was getting home to do this interview, and I was sitting next to a woman who was asking, her skin was very dry. She was 50 years old. She looked like she was 50 years old. Yeah. Okay. I thought maybe she was older, and
you can tell who's not on estrogen. I can tell.
Yeah. Oh my gosh. Immediate. So she's dry skin, and she's asking what to do for this dry skin. medicine. And my hairstylist is like, oh my gosh, you just happen to be sitting next to
Yeah.
like literally a perimenopause and menopause expert. And I was like, okay, well, tell me break it down. And basically she was like, well, my doctor put me on birth control.
Oh, that's not hormone replacement,
No,
y'all.
it's endocrine disruptors, especially. And she's like, and she's just going to keep me on it until I'm 52 years old. And I was like, that's a big part of what's going on right now. There's no amount of estradiol or progesterone being made. You're not even getting the last of it that your body would be making. I'm like, it's lazy medicine. I was
It's
like,
super lazy.
Oh my gosh. I was like, and that's what you're seeing. I'm like, and that's not even the concern. I mean, obviously we all care about having beautiful skin, but I'm like, but what about the cardiovascular situation, the increased risk of dementia and inflammasomes in the brain, or even the diseases of frailty like osteoporosis? And so she was like, whoa, she's like, well, let me go back to her and see what's up. And I'm like, there's a good chance that she's going to tell you to stay on those until you're 52 years old. And I'm telling you,
yeah, if they prescribed it, they're not the right doctor for this.
Yeah.
I just think I agree with you. It's lazy medicine. And if your doctor is telling you this, I think it's time to find another doctor.
Yeah. So I gave her some other resources and some other locations. And I could tell it was, again, there's some deep belief. Her mom grew up without hormone replacement therapy because she was at the generation that she didn't get to have it. And so I was truly, a lot of it was trying to dispel that belief. I said, I am about to be 45. I'm on both estradiol and progesterone as we speak because I'm not willing to wait until my levels start to drop.
I'm on all of them too. And I can't imagine not being on them. And to me, it's replenishment. It's not replacement. We're just bringing it back up to some normal levels.
I'm pretty sure our menstrual cycle and our ovarian function is our fifth vital sign. And there is no age where it is appropriate to lose that vital sign and have hormone deficiency. If you were in premenopause or early menopause, so let's say you had, a complete hysterectomy or an oophorectomy at 40 years old, standard of care is we would slap an estradiol patch on you. Unfortunately, a lot of people still wouldn't give you progesterone, but that really should be standard of care as well.
Especially if you're taking an estradiol patch.
The uterus is gone. So there's a lot of talk where, if you don't have a uterus, you don't need it. And I was like, I'm pretty sure that progesterone is not siloed to just the uterus. I'm pretty sure progesterone has receptor sites on every single system of the body. So why, if we lose the uterus because of a surgery, then there's no need to take progesterone? Like, that is just ridiculous to me. But so if you were 40 or 41, that is standard of care. It's even NAMS guidelines is if you have early menopause or premature menopause, you have to be on hormones, because if you're not, the increase of you dying early or having a chronic disease earlier than you should is so great. But then we fast forward 5-10 years later, and all of a sudden it's okay for us to lose all these hormones. And I'm like, what happened between the 10 years? If anything, we've aged more 10 years later, and we need that support. And so it's just, to me, it's just so backwards. But we'll give you high levels of endocrine disruptors known as birth control instead.
That's right. It
doesn't make any sense to me.
Yeah, that's so interesting. Let's talk about thyroid for a minute. How is thyroid play into all of this? Because I understand that thyroid misfunction can also mimic some of this.
Oh, absolutely. So I have thyroid dysfunction. I was diagnosed with Hashimoto's thyroiditis, which is a very common cause for hypothyroidism. So if you have, TSH, that is, to me, it's under 2 or 2.5. It's worthy to run the full panel.
TSH is thyroid stimulating
hormone. Sorry. Yeah. And that's a pituitary gland hormone, by the way. It is not a thyroid hormone. And so I would run the full panel, but 80% of the time. And you say
full panel, you're meaning T3, T4, reverse T3, all of
that, TPO and thyroglobulin. Yeah. I would look at the antibodies. I'm working with a woman who's got low thyroid function, basically low T4, low T3, and TSH is elevated below my optimal range, thyroid stimulating hormone. Then I would always run the antibodies. And most likely there's an autoimmune component.
Yes.
Now, T3 and T4, T3 is what I call the gasoline. T4 is the crude oil. So T4 is converted over to T3, but T3 has receptor sites on every single cell in the body. So there's only 3 hormones that have receptor sites on every single cell in the body. And it's going to be cortisol, thyroid, and
Mhm.
insulin, pretty much. Not even estradiol, but
Okay.
she comes close. And so when we start to see decline in low thyroid function, we'll notice a lot of the same symptoms as insulin resistance or even perimenopause. Again, because of that low level of estradiol is driving that insulin
Wow.
resistance. And so I think all of it needs to be ran. We need to look at a woman from every perspective, not only her symptoms, but also the labs to corroborate and validate what she's going through. But I think, I have a dear friend of mine who's my thyroid doctor, or my thyroid practitioner is McCall McPherson.
Mhm.
And I've talked to her many times about this. And she tells me, she's like, it's not a matter of if, it's a matter of when. And so often, when we start to see a decline in these very critical reproductive hormones, we see an uptick in inflammation. And that is
Mhm.
where we'll see a greater rise in autoimmune conditions, particularly Hashimoto's thyroiditis in midlife due to these changes. So, yes,
Yeah.
always be looking at the thyroid, especially if you're dealing with constipation, hair loss, brittle nails, slow gut motility, weight gain, fatigue, brain fog. These are all very classic symptoms of low thyroid function.
So it's so interesting because literally we could have this same conversation, but be talking about gut health, or have the same conversation and be talking about just hormone replacement, or have the same conversation and talk about just replacing T3, T4. So you could take like these same lump sum things and plug it into, maybe it's blood sugar, maybe so. And so I can see why it gets so confusing for
Yeah.
women. So I want to kind of unpack that a little bit, because I think number one, the first thing that's happening wrong is that some doctors, some people are just going, oh, it's just your age, suck it up.
Yeah.
Because that answer does not work, because
No.
no, it's not just your age, suck it up. But we have to be a detective and figure out which of those things. Do you find there's kind of an order of priority? How do you
Yes.
talk to us about that?
I do believe there's an order of priority. I do believe that your cellular energy is everything. Your
Mhm.
mitochondrial energy is everything. It really sets the tone for all of it. And what impacts your mitochondria are going to be the same things that impact your gut. And what impacts your gut is going to be the very similar things that impact your thyroid. So I find that the assaults, the root causes, which
Mhm.
I think we talked about, we got into, and then we pivoted a little bit. They're very much the same across the board. The same things that are gunking up and causing stranger danger moments with your mitochondria are often
Well,
the same things that are causing major alarm bells in your gut
so
microbiome.
let's kind of go, if we could go through
Yeah.
this. I just want to kind of put this in a nice bow here,
Yeah.
because I think it can get very confusing for women. I
Mhm.
get why it's confusing.
Absolutely. So what I consider the biggest root causes, and gosh knows I've had them. Sometimes they're coming back
Mhm.
into circulation. Number one is going to be, again, ultra processed foods, acellular carbs, added
Okay.
sugar. And they can be sneaky, they can be insidious. That's why I
Mhm.
always tell people, like, really just scrutinize over all of those labels. And and I know this is time consuming, and gosh knows it's because
Yes.
we do it ourselves. Make as much of the food you eat in your kitchen.
Yeah, and I love that you just said that, because, I'm thinking about my Thrive community, and every now and then you'll have a woman come in and say like, it's just hard. I don't want to eat this way. I don't like it. Well, my question is, do you want results or do you want comfort? Because
Yeah.
unfortunately, we have to make a decision at some point. It's like, do you want to convince me that you should be able to eat this stuff, or do you want results? Because to get healthy, we cannot rely on those foods.
Yeah, I was meeting with a VIP patient of mine today who was trying to convince me that I was like, girl, you don't have wiggle room.
Yeah.
Like you are operating, you're eating metabolically healthy meals, you are loving your gut, you're getting the fiber, you're hitting your protein numbers, we're getting your prediabetes under control. And I was like,
Well,
and
you
now you're trying
cannot
to
have
convince
pizza
me.
a few nights a week.
Yeah,
You just
that's what she
can't.
was trying to do. She's like, well, I could, what about gluten-free pizza a couple nights? I'm like, there is
No,
nothing,
there's no
no,
wiggle.
no, there's
Yeah.
no wiggle here. I have never met a gluten-free pizza that my blood sugar loved.
So
I just
I was just camping recently, and I eat just like you do, Marisa, but just like your gluten-free, dairy-free cake story. I'm camping. I'm like, I want s'mores. Like that's what I wanted. I just, and we went to Target and to get marshmallows, and there's no pack of one marshmallow or two. So you
No,
buy a
there's like
pack of like
100.
100. So, and I had my s'more. I was very happy to have it, knowing but I literally still feel it days later. Like it's
Yeah,
like that sugar spike. I feel that in my system, and you start craving more carbs. And it's like, it's a never ending cycle. When you just can stay off of it, you don't have those cravings. You don't have that fluctuation.
exactly. So it's a big one and it's more insidious than you think. Even what our son eats, my little
Mhm.
3-year-old eats. I mean, it's crazy. I remember sitting my husband down and saying, we're cooking everything. We're
Yeah.
cooking everything. And he was like, yep. That's what
It's
it is.
frustrating, but you have to do
Yeah,
it. Like you
like
don't know.
we're cooking snacks. We're cooking. I make his protein balls, from the ingredients that I know. So I mean, yeah, it's time consuming, and gosh knows I'm busy, but I have to ask myself, like, what is my family's metabolic health worth? When a
Yeah.
third of our children between the age of 12 and 19 have pre-diabetes, a
Okay.
third, it's a lot.
That's
Okay, so the
crazy.
next
So
thing,
first one was sugar, processed foods, starchy carbs. Basically, it's
yep,
all lump sum here.
yeah,
So
refined carbs.
even if it's
Yep.
gluten free, even if it's fat free, it's processed junk. So no
Yeah.
to that. Okay. Number two.
Next thing is stress.
Okay, let's talk about that because that's definitely not a good one for me. I'll tell you that. Like I have
No.
not mastered that.
Honestly, the highest number I ever saw in my blood glucose was because I was racing to an appointment. I hadn't
Hmm.
eaten at all, like for hours, and it spiked over 150 milligrams per deciliter. It's like
Wow.
175, and I was like, oh my gosh. So stress to me is like, especially when we're racing around and we're constantly in a state of chronic stress, you might as well just eat that cupcake because that's exactly what you're doing. And a lot of our stress is really related to our beliefs around how productive we need to be, how many things we're
Mm,
conquering. And so, I mean, this is a whole nother, but let me just share. This was one of my favorite kind of snippets from the Journal of Hormones in 2009. It says chronic stress can lead to overeating, co-elevation of cortisol and insulin, and the suppression of certain anabolic hormones and white blood cells. So the suppression of your immune
wow.
system. This state of metabolic stress in turn promotes abdominal visceral fat. Both the direct stress response and the accumulation of visceral fat can promote a systemic inflammation and oxidative stress, ultimately ending in disease.
Wow. Okay.
Yeah.
That's so.
So
Any
there's
advice
that.
on that? What do we do?
So I'm a big fan of first knowing your triggers, like
Hmm.
really listening to your body, and a big trigger for that is going to be like, are you getting clammy? Do you find you're getting everything's getting tight, that your mind is racing, that all of a sudden you're in like massive conquering mode, or you're snapping at your family members? Like, what does it feel like? And then like implement breath. One of my favorite breath techniques is the 4-7-8. So you inhale for 4 seconds,
Hmm.
you hold for 7, and you exhale for 8. Another thing that I love is somatic work. So shaking out
Hmm.
that cortisol energy, or maybe it's old trauma. So dance, it could be even like, like really kind of heavy going dancing where you're really moving the energy, walking outside in nature.
That's it. That's one
Yeah.
I've really noticed lately. Ladies, listening up to this one. Like if
Yeah.
you like today happened as I'm interviewing you today, I happen to have a very unusual day of sitting. So I've had meetings happening since first thing this morning, still on now, more sitting than I ever do. And I can literally feel it in my body like this. I've got to move. Like
And
it's
energy.
that
Yeah.
you feel the cortisol, like you feel it.
If there's anything you take away from this interview, not the numbers, not that ultra processed food is killing you, because you know that, it is that the number one longevity hack that you should double down on from morning to evening is walking outside in nature.
Mm-hmm.
There is nothing that walking outside in nature does not fix,
That's right.
including metabolic issues. Now, yes, you need to be lifting those weights, but
Yes. And
that's
does
only
make
a
it
30
easier because
minute,
I
40.
was
Yeah.
in San Diego for 20 years like you are, Mariza. It makes it
Yeah.
easier.
It
Right
does
now in
make it easy.
Scottsdale, when it's 120, I don't really want to walk outside.
Yeah, or
But
I have a walking desk right here next
yes.
to me. So I have a walking desk. I have a Peloton. I was reviewing copy today on a Peloton, and right after breakfast. But also, you want to really double down on that longevity hack and make it a massive blood sugar hack,
That's
is
great.
walk or do something. Walk your stairs, do 20 air squats, bust out some push-ups, some jump squats. So I love jack squats.
Hmm.
After every meal, I move my body somewhere between 5 and 10 minutes. Ideally, I love it to be a walk, but not every day. It works out like that, kind of like you, big meetings. So
Hmm.
instead, I will just bust out 2 minutes of HIIT, like a
Yeah.
little exercise snack.
Yeah. So, okay. So you said number one was the sugar processed foods. Two is the stress. Three
Yep.
is this a separate one, moving your body.
Yeah.
Three. Okay.
Yes. Movement. So movement, a lack of movement,
Yep.
sedentary lifestyle, which is 66% of us aren't even getting. I think the average
Totally.
person is clocking 3,000 steps a day.
That's crazy.
Yeah.
We
And
need
we
to
really
about at
need to
least
be
10,000.
at least, yeah. I mean, at the very least 8,
Okay.
Okay. The next thing is going to be toxins. They're
Yep.
endocrine disruptors, even birth control.
Hmm.
Birth control is an endocrine disruptor, but chemicals in your water, chemicals in the exhaust, in your car, chemicals inside of your personal care products. I mean, all of that. Plastic. You'll never see plastic containers in my house. It's all glass, chemicals in your water, in your house. So whatever you can do to mitigate the amount of chemical load. Your mitochondria work so much better when they are not inundated with chemicals. But also, one of the big reasons why ultra processed food is so dangerous is the freaking chemicals. That's the big reason. So that's going to be, and then the next one, I think, and it's hard to avoid some of these, but it's going to be, transmutable diseases. So mold, parasite, viruses, bacteria. I had no idea. So we would be as sick as we were with a preschooler in the house.
Yeah.
Like I thought I had we do have a great, robust immune system, but no, I guess I was just avoiding little people coughing in my face all the time.
When you have toddler, it's a whole different world.
It's a whole different world. So bacteria and virals, if you think about COVID and the impact that COVID's had on our reproductive health, and I've known women who went into menopause because of long COVID. And there's those aren't doing us any favors either. And so clearing those, and I often, you're looking at those kind of once you hit all of the other pillars. And then you're like, okay, I'm still not well. Like we went through a massive mold remediation, but don't think we didn't click all the other boxes first. Before we were like, okay, is it mold?
So if you're doing all the things right, I want to offer like a little bit of opinion from me. And then I would definitely want to get your perspective on this. Cause there's definitely people listening that go, okay, I'm doing all these things. Like I'm not eating processed foods. I'm working on this. Like I'm doing all these things. I'm avoiding this stuff. And I'm still have these crazy markers that are not working for me. My first question I'm going to throw back at people is, are you really doing all them? Because if I dig through somebody, and I can usually find that they're not, they say they are, but they're not. It's like what you said, it's still the pizza 3 times a week. It's still oh, but I'm still having Diet Coke. Oh, but I'm still doing this. So my first question is like, are you really doing that? What would you add to that? Because I don't want to I'm not getting people in trouble. This is not a grade. This is not a test. If you really believe you're doing all the things and your numbers are not changing, what do you suggest for them?
Absolutely. No, it's an audit. It's time to do an audit. Like, let's do a food journal. Let's put on a continuous glucose monitor. Wearables are a lot cheaper than like that deeper testing. How is your heart rate variability? What's your body score? What's your sleep score? So, we live in a time where we can really bio-individualize what is going on, and we can biohack our bodies with wearables. And it's a small investment. I tell people, put a continuous glucose monitor on, even for 1 month. It's one of the best investments you can make. Buy a Whoop strap or buy an Oura ring and track that for 3 months and see what's going on. So that would be the first thing, is like, test, don't guess.
Yes, I agree with that. Yeah. You just mentioned HRV. Can we just touch on that for a minute? Because HRV is so individual for people.
It is individual for people. And I think with a really big part for HRV, heart rate variability, which is really, it's again, measuring the variability between each heart rate. And the longer that gap is, that variability between those heart rates, we know that we have more resilience, less likelihood of, dealing with a cardiovascular event or having inflammation. And so, but, when we're running on high levels of stress, we're running on stress in the system, we're going to see that variability drop. Or if you're a mom, like the woman I was talking to at the hair salon today, she's like, okay, well, once I get my kids into college. And I was like, today is the new later, And so she was like, I need to take care. And just like, how many women are that way, where they're just like, let me handle my family first. And I wanted to ask her, and she wasn't in an intake with me. We were just at the hair salon, but I wanted to be like, how long have you been saying that? Decades? I don't know,
Great point. Well, Mariza, this has been so fabulous today. You're so knowledgeable. This is incredible. Where can people find you?
Absolutely. So I have a podcast called Energized with Dr. Mariza, and it's literally focusing on women's hormone health and metabolic health, because if that's the ticket, like, how do we dial that in for everyone listening? And then on Instagram at Dr. Mariza, so DrMariza.
And then you have a summit coming out too.
I do. Yay. Yes. So, again, so many questions around HRT. Is it right for me? Should I get on it? Is it too late for me? And what does it look like to actually build, resilience and great metabolic health? How do you have the freedom to do what you want in your 70s and your 80s? And so I've taken all of the biggest thought leaders and doctors in the area of perimenopause and menopause, and I've culminated them all into one place. And so the event is free October 14th through 19th. and you're going to get all kinds of goodies as well. But what I recommend is you go and listen, register, get the free guides, get all the free stuff that you can start taking action on now, including a blood sugar, like all my favorite blood sugar hacks. But then listen to the speakers that like, this is the thing I need to solve, you know, whether it's sleep issues or thyroid issues, or it's an autoimmune condition from Dr. Sarah Gottfried, whatever. I'm going to cover the gamut of what you need to know. Can I be on HRT after breast cancer? We are going to be covering that topic.
That's amazing. And we'll link up all these things in the show notes. Thank you so much, Mariza. Stay on after Mariza. For those of you listening on YouTube or podcast, we have an after party where I invite my 365 members in to ask questions. If you're interested in that, you can go to midlifeconversations.com/live. And we're going to wrap the podcast now and take it over to the after party. Thanks, Mariza.